What are we doing here? So you're looking at the anterior side of the heart. So this is the right ventricle, and this major vessel coming out of the right ventricle is the pulmonary trunk. This is your aorta coming out of there. This is the ligamentum arteriosum. So that's the little, used to be the ductus arteriosus that closed when we're born. Used to be a bypass, but that's a feature that's in your lab. You just come back to the surface of the heart. This is the right atrium and left atrium. These flaps of tissue are the auricles of the atria. So and auricles means ears. You have then you've got the right coronary artery and left coronary artery right here. And then the left coronary artery branches pretty quickly and becomes the anterior interventricular artery, and then the circumflex artery going around that way. This big vein that comes up and then swirls around the back is the great cardiac vein. It's called the great cardiac vein. From the right coronary artery, there's a pretty large artery that kind of comes from the lateral surface of the right side, and that's called the right marginal artery. And then the vein that follows the same path is called the small cardiac vein. Small cardiac vein. And on the right side here, you've got this green part. It's actually meant to be part of the conduction system, and that's the sinoatrial node. And that's superior vena cava coming in, inferior vena cava over here, and then those both enter, and that's the SA node, sinoatrial node. You can open it up. You got the interventricular septum on both sides here.
Which was the
ventricular septum, just this dividing line. That's the interventricular septum. You see the inside of the atria, the right and the left atria. This is the right AV valve, so that's your tricuspid valve, and this is your bicuspid valve. You see the aorta here, and that's the aortic semilunar valve here at the base. On this side where you got the pulmonary trunk coming out, that's the pulmonary semilunar valve there. It gives you the dup sound when it tries to close once the heart starts to relax. You got papillary muscles here, and you've got chordae tendineae too. So papillary muscles with chordae tendineae. This is another part of the conduction system. This is your AV node, the atrioventricular node. And that sends the AV bundle comes through here, and then these two white lines here, these two groups of white lines, are the right and left bundle branches. And when you can see those divide into little branches themselves, and those are called Purkinje fibers. These are all Purkinje fibers, and that's what stimulates the muscle directly. This is right and left coronary artery. This is where they come off of the aorta, at the very base of the aorta there. In here you see these ridges of muscles that are associated with the auricles, and those are called pectinate muscles. Pectinate muscles. And here's your trabeculae carnii in here. And this big ridge of muscle that goes across the right ventricle is the moderator band. It's the moderator band. Inside here you see the fossa ovalis. Used to be the foramen ovale in the fetal circulation, but that's the fossa ovalis, the remnants of that. On the back side, you've got the posterior interventricular artery, and that follows the same course as the middle cardiac vein. The middle cardiac vein plugs directly into the cardiac sinus here, or coronary sinus, coronary sinus. Oftentimes it has a left marginal artery too, so this is part of the branch of the circumflex artery. These are pulmonary veins returning oxygen-rich blood to the left side. What else? This is where the coronary sinus empties into the right ventricle, right atrium. And these are where the pulmonary veins enter the left atrium. Not sure what else. I think we're good.
Good.
I think so.